Hey everyone, thanks again for joining me on another episode of DxTx. I'm your host Sahan and Safi, and this week we're going to be talking about the treatment of pink eye. Let's get started. Since the last time that we spoke, a lot has happened. The Raptors are finally NBA champions for the first time, and the summer seems to have finally arrived. So hopefully you guys are enjoying the weather and staying safe as it gets nicer outside. Last week we did talk about pink eye as well as how it presents, the signs and symptoms of pink eye. If you missed that episode, you can see the link to it up here. However, this week we're going to be talking about the treatment of pink eye. The really nice thing about the treatment of pink eye is that it's extremely straightforward. Last week we talked about allergic, bacterial, as well as viral causes. And the biggest thing for you guys to know is that most of the cases of pink eye get better on their own. Even the bacterial cases are oftentimes self-limited and will get better without antibiotics. But you're probably wondering, how can I get rid of my symptoms? You wake up one day with a red eye, what do I do to make it better? And that's what we're going to talk about today. So let's say you wake up one day and you notice that your eye is red. The first thing that you should do is call in sick from work or school, because pink eye, as we mentioned last week, is extremely contagious. So conjunctivitis in and of itself, you touch your eye, you touch a surface, that bacteria or virus can live on that surface. If someone else touches it and touches their eye, they can get it. So it's easy for people to figure out who gave them pink eye most of the time, and it's often extremely contagious. So the best thing to do is to just put yourself in isolation until your symptoms resolve. The next thing that we oftentimes will recommend for our patients is for them to use warm compresses. So taking a towel, soaking it in water, wringing out that towel so that it just has a little bit of moisture, throwing it in the microwave for a couple of minutes, and then when you take it out, you feel that it's warm, and you use that warm towel to just kind of massage the tears away from your eye. Do that for about 15 minutes. Even if it cools down, continue to massage your eye. There's no problem. It's really just trying to clean out the eye of that infection. That's really the biggest thing that you're trying to do with warm or cool compresses. Now, we also mentioned that some of the symptoms of pink eye are that it's extremely itchy and it's extremely irritated. So oftentimes people say, what can I do? I don't want it to look red. I don't want it to be itchy. There are some anti-itch over-the-counter eye drops that you can get, antihistamine eye drops, that's going to make that itching feel better. But for the most part, a lot of those can still be irritating to the eye. So the thing that I oftentimes will recommend to my patients is just to use simple lubricating artificial tear drops to help with their irritation and not to help mask their symptoms, because a lot of those drops you put in your eye, those antihistamine drops, are going to make your eye feel better and potentially make the redness go away, but in fact you're still contagious. So you're only just fooling yourself and fooling other people. Oftentimes the infection's still there and you're spreading it to the community. So the safest thing to do is just to use lubricating artificial tear drops, one drop to the affected eye 4 times a day at the least, just to help with lubrication, and that oftentimes will help to resolve some of that irritation and itching as well. Now, let's say you're one of those people who think, for sure I have bacterial conjunctivitis or bacterial pink eye, and you watched last week's episode and throughout the day you got a lot of pus coming out of your eye, you've waited 2-3 days and it's not getting better, and you think, what do I do? What's the next step? If there's a lot of pus coming out of your eye, it's not just tears, it's not just irritation, it's extremely red and it's not getting better over the course of 3 to 4 days, it may be worthwhile to see a walk-in clinic or your family doctor to potentially give you some antibiotics. But like I mentioned, most of these cases should get better on their own, and the biggest thing that we always recommend as healthcare providers is try to control your symptoms as much as you can at home, because when you go out into the community, you touch surfaces, you go into the waiting room of a doctor's office, there's lots of other sick people there with lots of other medical problems, or you come to an emergency department. Really, we end up having huge issues with infection control because a lot of other people may end up getting your pink eye once you've left the department. So unless you got a ton of pus pouring out of your eye throughout the day, your symptoms really aren't getting better, if you're having a lot of pain or light sensitivity, or absolutely if you're having changes in your vision, you should get someone to look at your eye. But if you simply just have a red, teary, irritated eye and it's only been happening for a day or so, give it some time, use the warm compresses, use the artificial tears. Most of these cases do get better on their own. That's pretty much it for the treatment and management of pink eye. It's very, very straightforward. If you notice that you have a red eye, isolate yourself, try to avoid exposure to other people because it's extremely infectious. You can use warm compresses or cool compresses to help massage your eye and to try to clear it of that pus and the infection. And artificial tears, to help lubricate your eye. That oftentimes helps with your symptoms. If you can do that for a few days, most of the time you will see that you're getting better. Now, obviously, if you see you're having significant pain in your eye, it's not just itchy and irritated, but it's really painful. You feel like your vision is changing. You have lots and lots of pus that's coming out of your eye and you don't know why, especially if you're a contact lens wearer and any of these things are happening, then definitely have your walk-in clinic or family doctor or your optometrist take a look at your eye. This is still initially something that can be seen by one of these primary care providers before you've been seen in an acute care or emergency setting, and certainly if they think that it's something more ominous, they will definitely refer you to us to see you in the emergency department. Okay, so that wraps it up for today's show. I hope you learned something new. Get outside, stay safe, and enjoy the warm weather. I hope to see you next week when we're going to be talking about a little bit of those more ominous cases when it comes to red eye. What are those bad things that can give you a red eye, just for those that are a little bit more interested. I look forward to seeing you there. Until then, ciao. As a reminder, I just wanted to mention that if you are having any of the signs and symptoms that we discuss in our videos, DxTx and our channel is strictly meant for informational purposes only, and it is not meant to be used as a substitute for medical advice. If you're concerned at all in any way about signs or symptoms that you are experiencing, we always recommend that you get prompt and timely access as well as assessment by a qualified healthcare provider to determine what's going on and how best you need to be managed.